Hi, I'm Dr. Lenore Coleman. I'm president and founder of Healing Our Village and executive director of my nonprofit, Total Lifestyle Change. And what we do is provide diabetes education and diabetes training to people across the United States and abroad. And we have a ADA certified diabetes education program, and it's called Sugar Busters. And we have a 7-part series where after you've seen all 7 episodes, you'll know everything you need to know about diabetes. And if you still have questions, then we encourage you to join our Village Club, which is $6 a month, $72 for the year. And that gets you with my diabetes educators, my dietitians, my life coaches, all of the support systems that you need to be able to do a better job at controlling your diabetes. So last week was part 1, and we talked about what diabetes is, the difference between type 1 and type 2 diabetes, and how important it is for you to monitor your blood sugar. So that is very important. So today we are going to be covering medications. And most people who have diabetes really are very confused about their medicines. They don't know how their medicines work. They don't know if there's a specific time of the day to take their medications. A lot of people who have had diabetes for 5, 6, 10 years are on oral medications. They're still not at their A1C target of 7% or less. And so they need to start insulin, and they're hesitant to start insulin therapy. So we're going to talk about all of the medications that are used for diabetes. At this stage, we now can actually do customized medications specifically for you. We'll be able to determine what type of type 2 diabetes you have, and we'll be able to make sure we're picking the right oral medications for you to take on a regular basis. It's really important that you take your medications every day. Diabetes, once you have it, it doesn't go away. It's going to be there. And the only way you can control your blood sugar is by taking your medications, but also you're going to have to get on some kind of a nutrition plan where you're eating less carbs and you're eating less sugars and starches, which is what carbohydrates are. So let's jump into today's session. It's called medications. And there are basically 3 different types of medications for the management of diabetes. And we have oral medications, and we have injectable medications, and we have insulin. And so we're going to talk about all 3 of those classes. Now, oral medications and the injectable medications and insulin can all be used by type 2 diabetes patients. But type 1 patients can only use injectable insulin. So that's very important for you to know. So we know that people with type 2 diabetes, even if they're on insulin, okay, the oral medications that they're taking aren't insulin. Insulin is insulin, okay? It's an injectable product. The oral medications, the pills that you take, they're not insulin, all right? They are different pills that affect different organ systems, different physiology mechanisms in your body to help get your blood sugar down. So we're going to talk about the different medications and where in the body they work to be able to get your blood sugar down. So the oral medication, the pills that you use, either help your body make more insulin, so it makes your pancreas do a better job of getting the insulin into your bloodstream, or the insulin that's already in your bloodstream, these oral pills help that insulin work better. Last week we talked about the cells of the body have little doors, and you can think of it as a lock and key. And so there's basically a door to the cells. And insulin from the pancreas, which is a hormone, is a key that goes into your cells of your body, opens up that door so the glucose can get out of the blood into the cell. What some of the oral medicines do is make the keys work better so that that insulin can get out of the blood into the cell. Now, what all of you out there who have just learned that your blood sugar is high, have just gotten a diagnosis of diabetes, it's really important for you to know that the first thing we need you to do is get on a low carbohydrate, so reduce your sugars and your starches, low fat meal plan. And I try not to use the word diet, because this is really a way that you're going to change what you're eating for the rest of your life. So it's not a diet. It's not something you're just going to do for a short period of time, lose 20 pounds, and then you can go back to eating the way you used to eat. All right? It's not that kind of thing. And we need you to sort of figure out how you're going to get your exercise in every day, which is really, really hard. All right? There's a lot of people that, go to the gym every morning at 6 a.m., all right, I'm not that person. Some of you out there are not that person either. So for us, we have to figure out how to move more to get our steps in. And so I have a Fitbit here that I wear. I just bought a new one. And I'm trying my best to get my steps up to 8,000 steps a day. You need to be at least 8,000. They want you to be at 10. So when we talk about exercise, it's really anything that will help your body burn calories. That's what we talk about with exercise. And we'll talk about that on another of our episodes. Now, the way the diabetes medications work is they either increase insulin production and release from the pancreas, or they slow down the breakdown of carbohydrates. If you eat something sweet and your stomach breaks it down really quick, it causes your blood sugar to spike. So there's certain medications that decrease your digestion, so you're not digesting things so fast. There are certain medications that increase the ability of the cells to move glucose in and out of the cells. And there are certain drugs that work at the liver and decrease the production of glucose from the liver, which happens mostly at night. Now, this is a very complicated slide. I like to put it up here because you need to know that over the years, and I've been doing this for 40 years, over the years, since I have been taking care of patients with diabetes, what we know is that there have been new mechanisms of action that we have learned about in the body that contribute to increasing your blood sugar, contribute to what we call hyperglycemia. So initially, we only really knew about the pancreas, right? And we knew that the pancreas, the amount of insulin coming out of the pancreas as you got diabetes and as you continue to have diabetes got less and less and less, or that insulin from the pancreas didn't work. So the first drugs that were created were really focused on trying to help that pancreas put out more insulin. But then we learned about glucagon. And then we learned about the effect of the gut as it relates to increasing your blood sugar. We learned about the liver and that the liver produces glucose. We learned about the role of the fat cell. And so that can contribute to increasing your blood sugar. We learned about the brain. And most recently, we really have figured out a way to affect the ability of the kidney to excrete more of that sugar that's coming from the body through the kidney and then hopefully out into the urine. So there are actually medications that help that process. So we're going to go through all of those different medicines and their different mechanisms of action, all of which are trying to fix this core defect, which is inside the body that's causing your blood sugar to go up. Now, this is a long list of all the various medications that are out there. When I first got out of pharmacy school, there were very, very few medications that were out there available. All we had was animal insulins, and we had the oral sulfonylureas. Those were the two classes of medications that we had. Now you can see we have many, many more medications. We got the alpha glucosidase inhibitors and the amylin analogs. Those are not very commonly used. They are used in European countries much more commonly. We have the biguanide, which is metformin, and metformin is been around a long time. It was in Europe before it came here. And we know it decreases hepatic glucose production. It also increases glucose uptake from the muscle. We have the bile acid sequestrants like Welchol, not very commonly used. We have the DPP4 inhibitors. They've only been around most recently over the last 5 or 10 years. They also decrease hepatic glucose production potentially, but the main thing they do is affect a couple of chemicals that are in your gut, in your GI tract, called incretins. And so they basically increase incretin levels, and by doing that, they decrease glucose secretion. They also decrease glucagon secretion because insulin and glucagon go up and down. So if insulin's up, glucagon's down. If glucagon is up, insulin is down. So those drugs are affect that. Now you can know what if you're on one of those because the end of the drug name is Liptin. So it's allogliptin, linagliptin, saxagliptin, and sitagliptin. Sitagliptin was the first one that came out. That was Januvia. So a lot of you all are maybe out there on Januvia. Then we have the dopamine 2 agonists, again, not very commonly used. Now, we have the glinides, again, not very commonly used. That's your nataglinide and repaglinide. You have your GLP-1 receptor agonists. They're, again, new to the regimen of drugs that are out there. They are an injection. You can know that if you're on one of those because they end in the word tide. So it's exenatide, liraglutide, albaglutide, dulaglutide, lixisenatide. So those are injectable. I really like those medicines. They work really well in decreasing glucagon secretion. They slow gastric emptying. So again, if you slow down how fast your stomach processes the food and your gut processes the food, you don't have these peaks or spikes in your blood sugar. And that's good because we know that if your blood sugar spikes, it causes damage to your eyes, to your kidneys, to your heart, to your blood vessels, so to your nerves. So we don't want the spikes. We don't want the peaks. We would like your blood sugar to stay even all day long. So the GLP-1 receptor agonists are now on the list of medicines on the new guidelines where we, based upon sort of what kind of diabetes you have and your complications, this may be a drug that we may use as first line. We also are looking at the SGLT2 inhibitors. Remember I said there are some newer drugs that are used that affect the kidney and help the kidney basically eliminate that sugar out of your body. So they increases the urinary excretion of glucose. You can know that you're on one of those drugs because they end in flocin. So there's canagliflozin, dapagliflozin, empagliflozin. That's the name of those medications. Now, the sulfonylureas have been around a long, long time. What they basically do is increase insulin secretion. Many of you are still on those drugs, glipizide, glyburide, glimepiride. All of them end in the word "ide." I don't like those drugs, and the reason I don't like those drugs is because they decrease your blood sugar whether it's high or not. Some of the newer agents only decrease your blood sugar if your blood sugar is high. But these drugs can decrease your blood sugar whether it's high or not. And the reason I don't like that is because they cause low blood sugar reactions more frequently than the newer agents, all right? And then we have the thiazolidinediones. The only drug that's left on the market in this class is pioglitazone. The other drug was removed from the market. There's still some of you out there on pioglitazone. It increases glucose uptake from the muscle and the fat cells. It is an effective drug, but because of some of its side effects, a lot of physicians aren't prescribing pioglitazone anymore. Now, insulins. Insulins can be used in type 2 diabetes and type 1 diabetes. Type 1 diabetes patients have to use insulin. Type 2 diabetes patients usually have insulin added on after they've had diabetes for a number of years, and the oral medications are no longer working to keep your numbers under control, so that the doctor may need to add basal insulin, maybe just one shot of insulin a day at night. So those are the long-acting insulins. That's basal insulin. So that's your Levemir, your Lantus. Many of you are on that. Basaglar. All of those are long-acting insulins. Now, prandial insulins mean you take them before you eat. That's what prandial means. You're taking it before you eat. Those are fast-acting insulins. Some of you are on Humalog or Novolog or Apidra. All of those are fast-acting insulins. And then some of you may be on an insulin pen that has a mixture of intermediate-acting and fast-acting insulin in the cartridge that you put in the pen. So therefore, now you're able to get both fast-acting and intermediate-acting insulin in one shot, as opposed to having to take 2 shots or draw up 2 different types of insulins. So those are the insulins that are available on the market at this point. Now, let's just go through each one. Here's your metformin. It's part of the biguanide class of drugs. The generic name is glucophage. The generic name is metformin. The brand name is glucophage. There's very few people on the brand name product because it's been here in the United States for a long, long time. Basically, what metformin does is keep the liver from releasing too much glucose. That's what it does. Now, this drug is also in what we call combination products. So there may be some metformin with glyburide or with glipizide or with rosiglitazone, which is a thiazolidinedione. So you may be able to get one tablet that has a couple of drugs in it that contains metformin. And that makes it easier for you because you don't have to take 2 pills. You only have to take 1 pill. Oral medications, the next class is alpha glucosidase inhibitors. That's your Preclose and your Glycet, or your Acarbose and Miglatol are the generic names. Again, slows down your digestion, very effective, have a lot of side effects in terms of nausea, vomiting, and it creates gas. So a lot of patients do not like those drugs because of that. Your DPP-4 inhibitors, that's your gliptins, right? Sitagliptin, saxagliptin, linagliptin, and they basically decrease the glucose output from the liver and increase insulin release from the pancreas. They cause a little bit of diarrhea, a little bit of nausea, maybe some stomach pain, but by and large, most patients take these medicines and have no problem. So they sometimes have a little bit fewer side effects than some of the other medications. So these are drugs that are usually used early on in the management and treatment of type 2 diabetes, early on, because they only lower your A1C about 0.6%. So it's not a lot of lowering. So that's why you need to use them when your blood A1C levels aren't too high. Your SGLT2 inhibitors, that's the newest one on the market. This is also a class of medicines that's been given a lot of research here lately and have come out with some brand new study data showing that they are very effective in type 2 diabetes patients that either have heart disease or kidney disease. So because of that, because of the research, it showed that they are now have been elevated so that you can use these agents to, based upon your complications, as first-line agents. The way they work is they work inside your kidneys. As you know, your kidneys are what filter the glucose and the water out of your body and get rid of all the waste products, right? And so what these drugs do is help the kidney to move that glucose out of the body so it's not reabsorbed back into the bloodstream. Side effects is dehydration and vaginal yeast infection, especially in women. So those are the common side effects. But again, very few side effects. And with the new research, showing that they're beneficial for people who have heart disease or kidney disease. Again, these are drugs that many physicians are starting to prescribe as what we call first line. They're sort of the first drugs that people take. Now, let's talk a little bit about just medications in general. I'm a pharmacist by training, a certified diabetes educator, and I've spent my whole career dealing with the fact that most patients do not take their medicines as prescribed. So here are some tips for how to remember to take your medicine. All right, take it at the same time every day. Associate the taking of your medications with something. So I take my medicines in the morning after I eat my breakfast. Maybe or on my way to walking out the door to work, I remember to take my medicines before I leave. You see the little pill box on the picture. That really helps you remember to take your medicine. So I'm a strong believer in everybody having a medication tray, a pill box, so that they're able to remember that they need to take their medicines. And sometimes you need to take some of these medicines with your food, so you can associate it with your breakfast or your lunch or your dinner. So it's really important that you figure out ways that you can remember to take your medicines. Maybe you set your watch to buzz at a certain time of day to remind you that this is, oops, I gotta take my medications. You should store medicines at room temperature. You should always look at them before you take them to make sure that they don't have any markings on them or any spots on them, so that they're not deteriorated. You should always look at the expiration date on the bottle to make sure that you're not taking expired medications. Always make sure you throw a pill tray with your medicines in your bag, in your luggage. So when you leave town, you have your medicines with you, because it'll be very difficult for you to get your medicines especially if you leave the state. All right, so if you're traveling out of state especially, you need to make sure that you pack your medications with you. All right, we're going to take a little break right here before we jump into injectable medications. And we're going to have you get up and have yourself a cup of water, walk around in place for a few minutes, and then we'll be right back.
Epigallocatechin gallate, superoxide dismutase, glutathione peroxidase. Now, those are names you probably aren't familiar with, but you should be. Those are antioxidants known to fight free radicals. In fact, did you know that some viruses are actually alcohol resistant? One major study showed that by adding the epigallocatechins from green tea, it killed the virus on contact. Please allow me to introduce myself. My name is Mark Johnson. I'm here to share with you an exciting new, technologically advanced, patent-pending green tea hand sanitizing wash from Handout Protection. Now, this is not your typical hand gel designed to just smear all over your hand. This is a hand washing sanitizer to cover your entire hand, both the front and back of your hand, in between your fingers and your wrist. This is a non-sticky sanitizing hand wash designed for convenience to take with you in your purse, pocket, or carry in your lunchbox. As Dr. Josh Ridge has stated, what goes on your body goes into your body. That is why we choose only the highest FDA-compliant ingredients, such as 75% isopropyl alcohol and organic green tea brewed with alkaline water. The only way to protect yourself and your family is to always carry a disposable package of Handout with you. This may be the only handout you ever need.
Hello, I'm Dr. Lenore Coleman, President and founder of Healing Our Village. Did you know 88 million people in the United States have prediabetes, and that number keeps growing? Did you know that more than 2 in 3 adults in the United States are either overweight or obese? Healing Our Village is excited to introduce Step Up 90, weight loss and diabetes prevention program, all in one. Finally, there is a guided mobile app that will help you lose 5 to 7% of your body weight and help you get your 150 minutes of exercise in every week. All of this is available on your cell phone, notepad, or computer. To install Step Up 90, all you have to do is go to www.stepup90 from your phone or computer and hit the install button. Once the icon is added to your home screen, you can create a unique login and password or use your Facebook or Google login credentials. Do you have prediabetes? Does diabetes run in your family? Well, once you log in to Step Up 90, you can take the diabetes risk test. If you score more than 5, you may be at risk of developing type 2 diabetes. Step Up 90 features the CDC-approved Prevent T2 program, along with their food log, fitness log, and action plan. All materials can be printed or downloaded for easy use. Our monthly calendar provides our virtual class schedule with a reminder 30 minutes before the class to help you remember. Are you looking for easy to understand lifestyle videos, healthy recipes, exercise classes, nutritional support groups, or a cooking demonstration? All of this is available with our premium package. The most unique feature of Step Up 90 is your ability to chat with your lifestyle coach, a clinical pharmacist, or a registered dietitian. These experts will have weekly office hours. They are there to help you achieve your lifestyle goals and manage your medications. Sign up today for Step Up 90. We have our basic package starting at $5.99, featuring our weekly Zoom classes, and our premium package at $19.99. Step Up 90, it is time for you to step up. Hi, welcome back. We're going to talk about the medications used for diabetes management. I'm Dr. Lenore Coleman, President and founder of Healing Our Village. This is segment 2 of our Sugar Buster series about medications. So we just got done talking about the oral medicines. Let's talk about the injectable medications. As I mentioned, I really like the GLP-1 agonists. And the reason I really like them is because it helps you to lose weight. And most people with diabetes, 80% of the people with type 2 diabetes are overweight. And so this medication actually really decreases your hunger very effectively. So you just sort of forget to eat. How many out there forget to eat? Yeah, no, I know. We always think about eating, okay? So these drugs actually help you not eat as much. So when you're now on your meal plan and you're trying to reduce the amount of calories you're taking in every day, these drugs make it easier for you to do that. As I mentioned earlier, they end in the word tide. So you got your semaglutide. That's the Rexultis, the Ozempic commercials you're seeing on the TV so much. Then you got your Victoza, which is liraglutide. Byetta is exenatide. Lixisenatide is Linzumia. You got albaglutide and Trulicity. You see a lot of those commercials as well. That's dulaglutide. There have been a number of recent studies with these agents as well. So they have some ability to really help with your cardiovascular issues. They definitely help you with weight loss. So again, these drugs have now been elevated, so they're being used earlier in the course of your type 2 diabetes. Basically, they work by increasing your insulin release from the pancreas. They increases your cell's ability to use your own insulin, and they increase the feeling of being full. So you're just not hungry. You just feel like you're full. So I know that because I actually use one of these medications. It stimulates insulin release only when the blood glucose levels are higher than normal. So very little chance of you getting low blood sugar reactions. So that's the other reason I like it. In terms of tips, they come with a pre-filled pen that you see there in the picture, so I like that. It needs to be stored in the refrigerator until you're ready to use it, and then it can be stored at room temperature. Possible side effects are headache and dizziness. The loss of appetite and the weight loss is actually good. So it's categorized as a side effect, but it's actually good if you have type 2 diabetes. Now, who should use insulin? All right? people with type 1 diabetes, some people with type 2 diabetes, and definitely if you are in the hospital, you're getting surgery and you have diabetes, or if you're during your pregnancy, some women require insulin if they have diabetes and they're pregnant, or if you get or contract a severe illness. So for instance, the last couple of years, people with diabetes had an increased incident of the COVID hospitalizations. There were a lot of people with diabetes that ended up in the hospital because of COVID. And so those were usually people whose diabetes was out of control. Not normal. If your blood sugar was in good control, you didn't necessarily have the bad effects of COVID. But those people whose blood sugars were high ended up having problems and ended up going to the hospital. Those folks during that time they were in the hospital needed to be on insulin. When should you use your insulin? Well, someone without diabetes, the way it works is your pancreas puts out a little bit of insulin all day long. That's your basal insulin, right? And that steady amount of insulin all day long helps your fat cells not break down and create ketones. And we'll talk some more about that. There's also, when you eat food, an extra boost of insulin that comes from your pancreas. So that's what happens if you don't have diabetes. So when you do have diabetes, we're trying to mimic that. We're trying to do the same kind of thing with injections that happens normally in the body. So again, we mentioned basal insulin. That's your long-acting insulin. And it basically keeps your fat cells from breaking down. It helps all the organs in your body work efficiently. And so you need to have that little bit of glucose, a little bit of insulin in your body. And so you take your shot in the morning, and that shot lasts usually until the end of for a 18 to 24 hour period of time. Now, before your meals, you're going to need to take bolus insulin. Sometimes some people take it 3 times a day, breakfast, lunch, and dinner. Some people only take it 2 times a day. Some people only take it 1 time a day. Really depends on your blood sugar, how your body reacts to the foods that you eat, and that determines how many times a day we're going to need you to use your bolus or fast-acting insulin. Now, in terms of what insulins fall in which category, as I mentioned, your Novolog, your Humalog, your Apidra are considered to be rapid-acting insulins. Your short-acting or fast-acting insulins are your regular, all right? And there's a big R on the bottle. Your basal insulins, your intermediate acting is your NPH and Lenti. The NPH has a big N on the bottle. The Lenti has a big L on the bottle. Your long-acting insulins are your Levemir, your Lantus, and your Basaglar. And then there are some combination insulin products, as I mentioned. They're called premixed, where you have the intermediate and the short-acting in the same cartridge, which is put inside an insulin pen. And so that's really good for a lot of patients who need to be on the insulin. Now, timing and dosing of the insulin must be given exactly as prescribed at the right time. So if your doctor says you should take it 15 minutes before the meal, then you need to take it 15 minutes before the meal. The rapid-acting insulins, we know, act very quickly. They start working in about 5 minutes. They peak at about 2 hours, and they're out of your body at about 4 to 5 hours. Needs to be taken with meals. And do not take it if you're not going to eat right away. If you take your insulin, the fast-acting insulin, and then you don't eat, you're going to get into a low blood sugar reaction. In terms of your regular insulin, with the big R on the bottle, that's 30 minutes before the meal. It starts working in an hour, and it is out of your body in about 6 hours. Again, do not take it if you're not going to eat. And then your long-acting insulins, they should be taken once or twice a day at the same time. If used alone, it can cause low blood sugar reactions, and you should not mix your Lantus and your Levemir, your Basaglar. You should not mix those necessarily in the same syringe with your regular insulin, so they need to be separated. I really believe in insulin pens. It improves patients' attitudes and adherence, and it really makes it better for you to have accurate dosing and inadequate mixing. So we're going to take a little break right here because I want to make sure that you all can get up again, get that little drink of water, all right, move around a little bit, and then we'll come back and finish up the program. Hello, I'm Dr. Lenore Coleman, President and founder of Healing Our Village. Did you know 88 million people in the United States have prediabetes, and that number keeps growing? Did you know that more than 2 in 3 adults in the United States are either overweight or obese? Healing Our Village is excited to introduce Step Up 90 weight loss and diabetes prevention program all in one. Finally, there is a guided mobile app that will help you lose 5 to 7% of your body weight and help you get your 150 minutes of exercise in. All right, so we're finishing up here with our talk about the medications used for diabetes. Again, you need to store your insulin that you're using at room temperature. Your extra bottles of insulin need to be kept in the refrigerator. You need to check the expiration date. Make sure you're never taking expired insulin products. In terms of where should I inject my insulin, most people use their abdomen. Because it's a pretty wide, large surface, unfortunately. And you do need to rotate the injections about 1 inch apart. So you sort of rotate around your tummy. You can put it in the upper arm. You can put it in the upper thigh. You can put it in your buttocks, but most people use their abdomen. Usually most people inject in what we call your subcutaneous tissue. So right there in the skin, right there, there's usually a little fat layer right there. Again, rotating your sites at least 1 inch apart where you inject, and you do not ever inject in a belly button. You need to dispose of your needles and your lancets that you use to prick your finger in a sharps container, or you can use a milk carton or a jar, just as long as you can seal it when you throw it into the garbage, so that nobody who picks up your garbage actually gets a finger stick, all right? So you need to be sure that you're disposing of your needles and your lancets properly after you use them. Why do people not like to use insulin? Well, there's a lot of fear of needles. A lot of people have bad memories of their loved ones being on insulin. So maybe you had a grandmother or an aunt, a mother or a father who were on insulin, and you remembered that as soon as they started insulin, they got sicker and went to the hospital. So that's sort of a connection that's not accurate. Right? That's not accurate. So this fear and anxiety is one of the biggest reasons why people don't use insulin. But sometimes, especially after you've had diabetes for 5 or 10 years, you're gonna need to get on at least 1 shot a day of insulin. Some people have physical barriers. They can't pull up the insulin into the needle. That's why I really like insulin pens. You don't have to have a lot of dexterity to do those. You just dial in the number and inject it, which makes it easier. A lot of people think that just because their doctor wants them to put them on insulin, that their diabetes is really bad. That's not true. It has nothing to do with your diabetes being worse. What it means is that your body is just not able to get that blood sugar down to where we want it to be, and your oral medicines, after a while, will start to fail. So it doesn't mean that your diabetes is necessarily getting worse. It just means that the medicines that you're taking aren't working as well as they used to work. Most people with diabetes are on other medications, so they may be on aspirin, baby aspirin for a blood thinner, or they may be on statin drugs, right? Lovastatin, rosuvastatin, pravastatin. They may be on a statin medication to lower their cholesterol, and they may be on, if they have high blood pressure, ACE inhibitors, because ACE inhibitors decrease your blood sugar, your blood pressure. But they also are protective of the kidney. So that's why you see a lot of people with diabetes that are on the ACE inhibitors for the protection of the kidneys. So that is the end of Sugar Busters medications. Thank you for tuning in today. I really appreciate you being there. And if you have any questions or anything that you need to know, we really would like you to join our Village Club. It's $6 a month. $72 for the year for you and your family to be able to ask questions of my diabetes educators and my pharmacists. You just go right to HOVHealth.com and you'll be able to see our Village Club subscription. Please let everybody know that we're doing this Sugar Buster series on Saturdays. So everybody out there that have family with diabetes, everybody needs to tune in. We actually are doing this segment live. So we're on my Facebook page. We're on a way for you to ask me questions. I have people here in the studio with me where I could actually answer your questions right now. So we really want more people to be watching this segment live. Comes on Saturdays, 12 to 1, and I really appreciate you all getting the word out for me. We want you to like and subscribe and to share this. It's very important. We also want to let you know about our Step Up 90. This is our diabetes weight loss program. If you join Village Club, we're going to allow you to use the app for free. And so you'll be able to tune in to our weekly classes. You'll be able to watch our food demonstrations and some of the other really neat things that we have with Step Up 90. So I really want you all to think about that. You go to stepup90.com and you'll be able to see all of those things that are available to you. So again, I want to thank you so much. Here is this website that we talked about, HOVHealth.com. We're selling the blood glucose meters. We're selling blood pressure cuffs. So we're here for you. We have your supplies. We have your education. So we have everything that you need. We do have Wellness Wednesdays that happens here at my Jonesboro location, Jonesboro, Georgia, Main Street. So if you have diabetes and you want to know what your blood pressure is, or you want to know what your blood sugar is, come on and visit us on Wellness Wednesdays between the hours of 11 and 3. We usually have somebody here that can do a blood pressure check or a blood sugar check, or at a minimum, we can get you signed into our Village Club program. So come on out over and visit us. Here again is our phone number for more information, 800-788-0941. Donate today to help us continue our efforts to my nonprofit, Total Lifestyle Change. We have our own nonprofit website, tlc-global.org. And again, remember, we're here for you through our Village Club membership. So we look forward to getting more of you signed up. All right, thank you so much for tuning in today, and we'll see you next Saturday. Take care. Hello, I'm Dr. Lenore Coleman, President and founder of Healing Our Village. Did you know 88 million people in the United States have prediabetes, and that number keeps growing? Did you know that more than 2 in 3 adults in the United States are either overweight or obese? Healing Our Village is excited to introduce Step Up 90 weight loss and diabetes prevention program all in one. Finally, there is a guided mobile app that will help you lose 5 to 7% of your body weight and help you get your 150 minutes of exercise in every week. All of this is available on your cell phone, notepad, or computer. To install Step Up 90, all you have to do is go to www.stepup90 from your phone or computer and hit the install button. Once the icon is added to your home screen, you can create a unique login and password or use your Facebook or Google login credentials. Do you have prediabetes? Does diabetes run in your family? Well, once you log in to Step Up 90, you can take the diabetes risk test. If you score more than 5, you may be at risk of developing type 2 diabetes. Step Up 90 features the CDC-approved Prevent T2 program, along with their food log, fitness log, and action plan. All materials can be printed or downloaded for easy use. Our monthly calendar provides our virtual class schedule with a reminder 30 minutes before the class to help you remember. Are you looking for easy to understand lifestyle videos, healthy recipes, exercise classes, nutritional support groups, or a cooking demonstration? All of this is available with our premium package. The most unique feature of Step Up 90 is your ability to chat with your lifestyle coach, a clinical pharmacist, or a registered dietitian. These experts will have weekly office hours. They are there to help you achieve your lifestyle goals, and manage your medications. Sign up today for Step Up 90. We have our basic package starting at $5.99, featuring our weekly Zoom classes, and our premium package at $19.99. Step Up 90, it is time for you to step up.